Hi, my name is Galen Blythe. I'm with Noble Insurance Solutions, and today we're going to talk about healthcare reform and how it impacts the individual or family marketplace. The exchange program, what that does is creates a marketplace, a central marketplace. It'll be known as Cover Oregon in our state, where individuals or families can go to purchase a qualified health insurance plan that gives them access to subsidies, whether it be for premiums or a cost-sharing subsidy on their health insurance coverage. It also gives them the access with healthcare reform, and this would be January 2014, guarantees issue or removes underwriting requirements for individuals and families. Individuals and families will be able to enroll as soon as October 1st all the way through March. That October 1st enrollment date, though, their plan would not be effective until January 1, 2014. As part of the provision, it states that they would be able to keep their plan if they keep the plan they have if they like it now. However, if they wish to gain access or have the best funding opportunities or subsidy, then they would need to purchase a plan through the exchange to give them that access. Beginning January 1, the individual mandate takes place where an individual, if they do not have a qualified plan or do not have a health insurance policy, come January 1st would have a $95 tax penalty for 2014, a $395 tax penalty in 2015, or $695 in 2016. And then after that, what we're being told is that it would be a kind of based off of inflation after that time. The basis of how it's being designed is a 4-tiered metal system, bronze, silver, gold, and platinum. Bronze being your base plan, platinum obviously being the highest level of coverage. For that bronze level right now, what we've been told is potentially would look like a $2,000 deductible looks now, but what it really entails is a $6,695 cap on your total medical expenses, and that would include a deductible, coinsurance, copayments, and even prescription coverage or prescription amounts that you would pay out in a year. And then as you go up the metal system, so a silver or a gold plan, you would have a lesser out-of-pocket amount, and platinum being the highest, where you could see as low as maybe a $2,000 or $3,000 cap on your medical expenses for the year. With the new plans in place as of January 1, 2014, the lifetime maximum, which has mostly been removed already, in Oregon prior to healthcare reform, most plans had a $2 million lifetime maximum that they would pay for any treatments for yourself. And come January 1st, that amount will be completely removed, so there is no lifetime maximum. And then also, up until this point, there has been called an essential health benefit, and these are some caps. It's been a $2 million cap on that also, and that is basically what a plan would pay per year for any given or basically dedicated services or pre-designated services that would be considered a essential health benefit. As of January 1st, any individual with a pre-existing condition will be guaranteed issue or guaranteed coverage on the plan. However, if you have not had coverage prior to applying, there can be a 6-month waiting period for that condition. If you've had continuous coverage for the 6 months prior to January 1, 2014, then there will be no waiting period on that condition regardless of what it is. And how that is determined, what is a pre-existing condition, is something that has either been diagnosed or treated by a physician in the previous 5 years. So anything that, again, that you had been diagnosed or treated for in the previous 5 years would be a pre-existing condition, and that would, some examples would be diabetes, heart disease, high blood pressure, cholesterol, asthma, allergies. Those are all, again, something that people would think of as a pre-existing condition. So the same applies not only for treatment, but medications also. So again, if you've had continuous coverage, there would be no wait for those medications. If you have not, and you do have, let's say, high cholesterol or high blood pressure, you have not had coverage prior to that, those medications would not be covered until that 6-month waiting period has been, satisfied. When talking about pre-existing conditions, those waiting periods or exclusions for the first 6 months of the policy, if you have not had previous coverage, will not apply to children under the age of 19. So they have any pre-existing condition, whether it would be asthma or leukemia, those will all have no waiting periods, even though it is a pre-existing condition, if they're under the age of 19. Applying through the exchange or Cover Oregon is how you, as an applicant, are going to qualify for the subsidy. And that subsidy is based on your income as a family, whether you're a single applicant or a family of 4. It is based off of the federal poverty level. And federal poverty level, a good benchmark is a family of 4. If you were making over roughly $92,000 per year, that you would have no subsidy for your premiums. However, you would have a cap on the cost of a plan. Roughly, right now it's being said 9.5% of income is your maximum cost. If you're making under that level, that 400% of poverty level, you can qualify up to a cap of, I think, 2 or 3% if you were at the federal poverty level, which would be about $23,000 for a family of 4. It's important to understand how the subsidy works. It's something that you can have applied to your premiums on a monthly basis, so they'll deduct the amount and you'll pay what's remaining of that premium. Or it is also something that you can do at the end of the year to receive a refund or credit on the premiums you paid throughout the year. It is, again, important to know, though, if your income is varying from year to year, whether you get a raise or you work on commission or receive a bonus, those are all going to factor into what you pay in premium. So if that changes throughout the year, you can adjust it. If you don't adjust it, then you need to be sure that you will either be receiving a credit or an additional tax or penalty if your income was to go up throughout the year. The time of year when that credit or subsidy or penalty would apply would be at tax time when you prepare your annual income taxes. A few enrichments or additions and benefits for plans on these qualified health plans that will be purchased through Cover Oregon. First of all would be the inclusion of dental and vision for dependent children. So if they're under the age of 19, pediatric dental or vision will be built in or included in the policy for those children. Another improvement would be for mental health, and how that is, mental health has been covered in the past on individual plans. However, it will be treated as any other disease or illness moving forward to include medications, as some plans in the past have not covered mental health medications on their policies. For those applying that are over the age of 19 and are looking for dental and vision coverage, that will be an additional benefit that they would need to purchase above and beyond their medical policy. Please go to our website, noble-agency.com, where you can use our premium calculator to determine what your subsidy would be based off of your income and the amount of family members enrolling. We want to reiterate that we're here to help people through the process. This is going to be a more detailed application than what has been in the past, where we will walk you through the steps of determining what your subsidy is and then helping you pick a plan based off of that cost that fits you or your family's needs.